Hi everyone, coming up on this week's Pet Stop, when summer vacation ends and kids go back to school, your pet might be feeling a little bit lonely, so we'll talk about separation anxiety. Plus, senior cats have special needs as they get older. We'll tell you what to look for. We'll also have our Pet of the Week and some great animals in need of homes, so let's get started. Hello and welcome to the Pet Stop. I'm Dr. Brian Voynick from the American Animal Hospital in Randolph. Cats are good at hiding their illnesses, and that doesn't change when they get older at an increased risk for health problems. And here to help us take a look at some signs to seek out is Dr. Jan Rottenberg, and she joins us from Just Cats in Edison. Welcome to the show.
Thank you. I'm
so glad you're here because it's absolutely true that they are masters of disguise, you know, and they could act like nothing's wrong, and all of a sudden, boom, you know.
They hide their pain very well, they hide their illnesses very well, and it's up to the pet owner to pay close attention to them, especially as they age, and look for symptoms that can indicate. Yeah,
well, you know, if a cat, cats are kind of smart. If they know if they act sick, they might be someone's next meal. You know, so they just hide all their.
Right.
And tell us about Max here. Max is your personal cat, thanks to Dr. Herman Berg, a mutual friend and a great veterinarian in New Jersey. And how did you come upon Max?
Max, I was told, was brought in to be euthanized. Actually, his owner had passed away. He had no place to go. Fortunately, for compassionate veterinarians and wonderful rescue people, Max got a second chance.
And Max is how old now?
Max is about 14. He's here as our representative of senior cats. He's got some senior problems. And he's on medication, a lot of supportive care, and we hope to keep him around for years.
Okay, and Dr. Jan, when are we calling cats seniors?
That's a good question. I myself like to use 12. I think cats are going well into their 60s. When they reach 12 years old, I seem to find a lot of the symptoms start at that age. So.
Right. And you and I know Dr. Justin Strauss. He's a terrific internal medicine specialist in Fairfield. And in fact, you went to Ohio State with him.
Yes, I did.
And he always stresses, as well as I do, the importance of a urinalysis, because that'll tip you off way earlier than a blood sample. Both are ideal. But especially in this economy and that sort of thing, some people just can't afford the whole shebang, but at least a urinalysis should be so important.
Yes, that's a first sign of kidney disease.
And Max is now 14. Tell us some of his issues.
Max came to us as a hyperthyroid, which we discovered from blood work, and he now has some early kidney disease as well. Okay,
so hyperthyroid. Tell us about because my cat Moonstruck, who I lost at 20 and a half, God bless her, she had hyperthyroidism as well.
Well, this is one of the more common senior diseases. I will say, as we talk, that a lot of these problems can occur in younger cats, but they are more common in senior cats. I've seen thyroid disease as young as 8 years old. Thyroid disease is very unique in that these senior cats are usually very hungry, not always. They're in the kitchen with you whenever you're there. They want food.
And they don't get fat. They eat like a horse and they don't get fat. They get skinny.
They lose weight. They lose weight. So something's not right. They're eating more. They're losing weight.
Good. So that brings us to the list that you supplied us with, Dr. Jan, as far as first thing is weight loss. And that's not real obvious in a cat, especially a long-haired cat. So we really need to weigh them on a regular basis. Most people don't have scales like postal scales at home. But if they did, once a month, on the first of every month, they should weigh their cat. Because that is so key, because losing 10% is very dramatic and significant, but it's rarely noticed.
It's usually very gradual, but you can see it. You can feel bones that you never felt before. They're easier to pick up. Their sides are a little sunken in.
Body conformation changes.
Yes.
Vomiting as well, you bring up, and that's an important sign.
Vomiting, yes, is an important sign. We all know cats are vomiters. They bring up fur balls, they bring up grass, they eat too fast and bring up their food. But this is a more frequent vomiting. It's often just liquid or or bile, little spots of yellow liquid.
Yeah.
With increased frequency, that's indicating a problem.
Could be very significant, especially if it, God forbid, is projectile, as we had one time. Which is sometimes, as you know, a scene with obstructions.
Yes.
And we had one cat that ate a musket, a lead ball, and just the X-ray revealed it immediately, and took it out, and it was fine. But the other thing is litter box behavior.
Yes, cats are very fastidious. When they get older, you might notice they're missing the litter box. They're not using it at all. They might be straining to have a bowel movement, lots of urine in there.
Sometimes if they're very arthritic and the lip is very deep, they just can't make it over. It's not comfortable for them. So sometimes it's good to cut out a little pathway to get in there.
That's an excellent idea.
Well, the other thing is, that, and speaking of the litter box, is the nature of the stool. Sometimes, especially in the older cat, it's rock hard, and that is a problem, a painful problem oftentimes.
Lots of
Go to your
things
vet
we can
immediately
do.
if you notice that.
Absolutely.
Change in appetite obviously is key.
Yes, usually you're going to see a decrease in appetite. You're going to see the cat that sniffs the food and walks away. You're also going to see the cat who wants to eat, goes to the dish, takes a bite, lets out a little yell, and runs away. That's an ouchy mouth. They're not going to eat.
Right.
At the other extreme, your thyroid cats. Who always want to eat.
Water consumption as well. They don't drink. They're very efficient, as most people know, as far as concentrating urine. But when they start drinking a lot, that's key, isn't it?
And that's seen in pretty much all senior cats.
Yeah, and you look at the litter box. If it's heavier than usual and that sort of thing, well, there's more urine there.
Lots of urine.
And slowing down, and a coat that starts to look shabby. They're not grooming themselves.
You know, they're very agile. They used to be able to leap onto your refrigerator in a single bound. Now they try for a ledge and they miss it. They can't get up on your bed. They're pulling themselves up on the bed.
So the important thing is a lot of times these things are not noticed and picked up, particularly weight loss and these sorts of things. So the importance is to see your veterinarian preferably every 6 months when they get older, and we feel their lymph nodes. We can listen to their heart and lung sounds, and really pick up things early. Early detection is the key.
Early detection is the key. They're not brought in often enough. Yearly checkups as they're growing old are ideal, but when they get to be seniors, it's not enough, especially when they have diseases that we're going to talk about.
All right. Hey, thanks, Dr. Jen. It's great to have you.
Thank you.
And thank you, Max.
It's a pleasure to be here.
Folks, still
Max
to come.
Says thanks.
You're a good dude, good old boy. Still to come, kids will be heading back to school pretty soon, and that can mean more isolation for our pets. Well, up next, you can learn what separation anxiety is all about and how we can deal with it. Plus, we'll have adoptions and Pet of the Week, too, so stick around. There's a lot more to come on the Pet Stop, only here on News 12 New Jersey. Welcome back to the Pet Stop. I'm Dr. Brian Voynick. Summer will be over soon and busy schedules will resume. And it's a good time to think about how your pets will handle the separation and isolation from the family, which can be an issue for some pet owners all year long. And my next guest is a frequent visitor to the show. We have Dr. Debbie Breitstein. She's from the Animal Health Care of Marlboro. Welcome back to the show, Deb.
Great to be here. Thank you.
Yeah, it's good to see you. So tell us about the what's going on in a dog or cat's mind at this time of year.
I wish I could tell you everything that is, but we'll talk about changes in behavior due to schedule changes.
Yeah.
And it's back to school blues for most of our pets because our schedule changes, their schedule changes, and they're not used to that. They don't go by a calendar. The most they know is the dog days of summer are done, and now it's time to change things up a bit.
And daylight hours change too.
They do, and that changes our schedules as well. And as we get into school schedules and work schedules and vacation changes have been done, now it's time to get into a finite schedule, and there's less time to get things done.
So what are some of the signs to look for?
Well, have you ever come home and found that your living room is just a mess of stuffing and your countertop's been rearranged by your cat? Well, our animals are just really anxious about being home alone when they're used to having the company all summer long. They've been outside more, the dogs have been walked more, some of the cats are indoor-outdoor models have been outside. Now they're home while we're away at work or school or our kids are at school, so it becomes a change for them.
Yeah, well, seeing that things are chewed up is an obvious sign. What about some of the not so obvious signs?
Well, there's another obvious sign that, everybody says my dog's spiteful. I come home and I find a prize package, an hours old elimination pile of pee or poop, and they wonder, oh, the dog's spiteful because I left them alone. And that's a problem, because they're really not. They're anxious. And so we really want to try and eliminate these kinds of anxiety-provoked behaviors by teaching them relaxation, giving them things to do, environmental stimulation.
Right. Well, you gave us a good list of things, and you started with 21 days. It takes 21 days to change a behavior.
21 days is the recommended time frame, an expectation frame for a new behavior to become an established behavior. But it's not something that's going to happen overnight. It takes work, repetition, patience, and being routine about things. Right.
You talked about that they're not spiteful, but what about don't reinforce anxiety?
Well, many times animals will respond to negative attention as well as positive attention. That's better than no attention. So inadvertently, we can reinforce some of these behaviors and not even realize it with some of our nonverbal cues, our verbal cues, our schedules, things like that can really set a dog or a cat off.
In other words, you want to give them affection not when they're having excessive barking, but when they're very quiet and
or give them something else to do. If you don't want this behavior, give them an acceptable behavior to do instead.
Good. And then reward when they're relaxed, provide stimulation, as you mentioned.
People think cats sleep 23.5 hours a day. They need environmental stimulation. Things to climb on, windows to look at. Dogs need something to do when you're gone. Food puzzles work great for that. Both dogs and cats can benefit from that.
Tell us about food puzzles.
Well, I will tell you that for
dogs, use one for my dog.
Dogs seem to do better with it. I've tried it with my cats. They look and they go, yeah, really? And that's, so it doesn't really help for them. But the food puzzles give them something to do to get the food as a reward. So you're giving them what they need, their food, and they're getting a reward, and they're doing something about it.
Right. So, one thing that works well for me is that clam-shaped thing that you can unscrew, and it has different diameters. You can throw some dry food in there and tighten it down to make it difficult.
Have to bat it around or nose it around and get the reward.
Shows soccer skills.
Yeah, there you go. They do something. They're also exercising. They're burning more calories, because if they're home when we're at school or work or our schedule changes, they're not burning calories, yet we might be feeding them the same amount, and then they'll gain weight, and that'll add to some other health problems.
And it's a good idea. Doggy daycares are good. But if
doggy day and play care are great.
Walker, if you can get to hire a walker.
If you can't be home and you're coming home to anxiety-provoked behavior, it's better to get a pet sitter, a pet walker. Give your pet something to do during the day. They'll really appreciate it. You won't come home to a mess. You won't have to be the cleanup committee. And everybody benefits. Everybody wins.
And for those getting new puppies, a good rule of thumb would be, for example, how many hours can you leave them alone in a crate? And it's analogous to about the months.
Or weeks of age.
If they're 2 months old, don't leave them more than 2 hours. If they're 8 months old, not 8 hours.
You never would leave anybody more than 8 hours anyway. But I use the same kind of scale in weeks. So if you're 10 weeks, probably 4 to 5 hours is reasonably what you can expect. But you have to set yourself up for that. If you want to get a new puppy or a new kitten at the beginning of a school season when everything's changing, well, you've got a lot on your plate.
Right.
And you just have to
How about
sure
retraining as far as the habits of the dog sees you picking up your car keys? Sometimes they just freak out.
So old dogs can learn new tricks. And yes, sometimes you have to vary the routine because they are stimulated by the routines that we set up. They learn, we reach for the key, I'm leaving, see you bye, and they get anxious about it. So if you leave by a different door, if you put your keys in a different place, if you don't spend time, and this is really hard to do in the meeting and greeting behavior, don't make a big deal about it. It's hard for us to do. We love our pets. They're part of our family.
And it's also good, they don't really keep track of time as we do. So it's a nice thing if they have these habitual problems where they see you pick up the keys. We'll pick up the keys, leave, and then come back 20 seconds or 10 seconds later when they still haven't barked and so forth.
Exactly, because you don't want to come home and hear your neighbors say, your dog's been barking and howling all day, your cat's been meowing all day. So yeah, vary the routine and reward them when they're not doing, reward them for good behavior. It's really important. So do it on the weekends too. Some of us have Monday through Friday jobs, not me, but not you, but sometimes you can use the weekends for training as well.
Right, and activity is so important, isn't it?
Got to keep the mind active, the body active, got to give them something to do. And it's really, really important to make sure that there are routines that are rewarding and not implement things that are going to be anxiety provoking.
What about medications? We have one of about 50 animal behavioral board certified in New Jersey, Dr. Emily Levine. But sometimes we will prescribe some medication if all else fails. Tell us about that.
And we do. We use. We start out with a foundation of things like, and people might call this integrative, but rescue remedies, some of the Bach flower remedies, the pheromones. We call them kitty and dog aromatherapies. Some of the pet relaxants. There are some foods that have some calming agents in them. Royal Canin makes some. and then we build on that. We don't subtract from that. We build on that foundation, and sometimes we do need active medications.
And see your veterinarian, because sometimes you can have medical problems that are massive.
Exactly. This is always make sure the medical problem's been addressed before you make them a head case.
All right, Dr. Deb, great to
Thank
see you again.
It's good to be here.
Thanks. Folks, now it's time for our pet of the week. And another Deb sends us these two pictures of her cool cat, an orange tabby named Prince Georgie. He definitely found a way to keep cool this summer. It looks like he's drinking lemonade, but hopefully not antifreeze. It's that color as well, and be careful about that. That's very, very toxic. Deb, thanks for sending those pictures. And if you'd like your pet to be pet of the week, send us some pictures or videos. You can mail them to that address that you see on the screen, or just email them to thepetstop@news12.com. But be sure to tell us why your pet should be pet of the week. Stay tuned. We'll be right back with this week's adoptees. Welcome back to the Pet Stop on News 12 New Jersey. I'm Dr. Brian Voynick. My next guest is Allison Yonkers, and she's with the Liberty Humane Society in Jersey City. And she's brought some really cute friends along looking for permanent homes. Good to see you, Allison.
How are you?
Good. How are you doing?
Good, good.
You've got a real cutie here, a little baby, little 8-week-old. And tell us the history here.
Yes, this is Beauty. This past Sunday morning, she was found outside the shelter, abandoned in a box with her mother
she's tiny.
and 2 other brothers. Yeah, and then, like I said, they're about 2 months old or so. They'll be available for adoption in another 2 weeks as soon as their stray hold is up and they've received their 2nd round of vaccinations. But they're very sweet. We believe that they're Min Pin Chihuahua mixes. That's what they look like.
I can buy that.
Yep.
And how about the good-looking kitty you got there? What markings, huh?
This is Lester, yes. Lester is a big tiger in a little kitty's body. He has so much energy. He just
Personality
loves to,
plus.
Yes, definitely. He would do great in a home, potentially, that has another kitten or another very active cat.
Okay, you got a little bit of time to tell us about your event. Tell us about that.
We have our biggest fundraiser of the year, Bark in the Park, coming up on September 29th in Hoboken. People can visit the website for more information, but it's a pet expo and dog walk fundraiser.
Oh, great. And we'll have that linked to our website at news12.com. Allison, thanks. And how are things going at the shelter? Are you overrun with kitties still?
Yes, definitely. Still dealing with kitten season, so if you're interested in a kitten, we have plenty to choose from.
All right, and plenty of dogs as well, huh?
Yes, absolutely.
Great. And what a good place to visit. I mean, you could, such a scenic area you're in right there in Jersey City.
Oh, yeah, yeah. The dogs love to go for walks in Liberty State Park and play over there. Yeah.
All right. Well, great to see you. Thanks for coming.
You too. Thank you.
Keep up the good work here. A little cutie, we'll see. And there's a litter mace as well, right?
Yes, 2 others. Good. 2 little boys.
Okay, folks, for more information on anything about today's show or past shows as well, log on to our website, news12.com. Just click on the features and scroll down to the Pet Stop. You'll find all of the information you need right there. That's all the time we have left on this week's show. I'm Dr. Brian Voynick. Thanks a lot for watching. And always remember, a healthy pet's a happy pet. We'll see you the next time. Bye-bye.